Hi everyone, in this video we are showing a trigger point treatment. So in this treatment, our goal is to first we're going to fully assess. We want to make sure that we're treating the correct areas. So if you're interested in learning more on a TMJ assessment, I do highly recommend taking the American Academy of Facial Aesthetics TMJ course, especially if you are a dental provider. This is something that is life-changing for patients and is a great additive to your practice. So starting off, we went through and we assessed this patient from her traps all the way up to her temporalis. So both trapezius, SCMs, splenius capitis, temporalis, masseters, and deep masseters as well. We've already completed the rest of this patient's toxin administration, but now we are going in and working on those trigger points. What a trigger point is in plain terms, it is a knot of muscle. So if you are going and getting a deep tissue massage, for example, and they're working out knots, in a sense, that is muscle fibers that is caught like very tough, fibrous muscle tissue that has been either from dependent positions for a job. For example, this patient, for example, has a desk job. So she's holding that tension in her traps while she's on her computer and typing and things like that. So she's in that, dependent, repetitive position, and she ends up getting these tight knots of muscle fiber, which is a trigger point. So a trigger point, if you press down and apply firm pressure, the pain will refer. So either up the neck, sometimes I've had patients feel it down their shoulder, but that pain is going to refer. That's how you know you have a true trigger point that you're assessing. So you can kind of see throughout how I'm kind of feeling and adjusting my placement as we go, because I want to make sure we're treating the correct areas for this patient. So like I said, if you're interested, about learning more about that assessment, it is more of a complex assessment, so definitely recommend taking that course. But here I have a 25 gauge needle. I'm making sure that I'm holding that muscle taut in between my fingers. I'm never letting go while I have my needle inserted. We are right above that lung cavity, so I always want to make sure I know where the end of my needle is. I like to say we're either going towards air or going towards bone. So if you're needling in a masseter, for example, we're going towards bone. And in this case, we are going towards air. I'm never directing my needle downwards and towards that lung. So just holding that pinch, going in and out. I'm only going about half my needle depth here, and I can physically feel that muscle fiber breaking apart. The best description is it feels like you're going through a styrofoam cup, and my goal is to just needle until that area is smooth.